Hello, everyone. Welcome to another episode of the Contact Listens podcast, Tools for Tough Moments. I'm Mazita. I'm the Clinical Program Director here at Contact.
And I am Michelle. I'm the Deputy Executive Director here at Contact Careline. And today we have a special guest. Vanessa Hensley from the McNabb Center is with us today. She's with their mobile crisis team. And that happens to be the topic for today's podcast episode. Vanessa, welcome. Could you tell us a little bit about your role and about the McNabb Center?
Yeah, thanks for having me. So I'm the services coordinator at the McNabb Center's Mobile Crisis. McNabb is a community health organization. We're a nonprofit. We go all the way from Chattanooga up to the Upper East. We serve adults and children. We've got outpatient services, residential, we're in schools, all kinds of stuff. It's pretty big.
That's awesome. And so for somebody who's never heard of mobile crisis, how would you explain that in simple terms?
Yeah, so mobile crisis, my team is made up of master's level clinicians and bachelor's level clinicians. And so what we are doing is getting people connected with the appropriate level of care that they need. So if someone is experiencing a mental health crisis, we can do an assessment and then help figure out where it is they need to go, right? So are we looking at getting them connected with outpatient services? Are we looking at more of an inpatient setting for them? So we're doing those assessments. We actually serve 11 counties. So for our Knox, Blunt, Sevier, Loudoun, and Monroe, we see adults and children, which is a little unique to some mobile crisis. And then we serve our Upper East, which is Cocke, Claiborne, Granger, Hamlin, Jefferson, and Union County. And those are strictly, we just serve the adults there.
Wow, that's a lot. You all really do cover a lot of ground locally.
We really do.
And support people from kiddos all through adults. So that's really helpful to know that there are different options for services kind of depending on where people are located. So that's wonderful to know. That was a bit surprising to me for sure. I'm learning something new here from you. And so I think I would wonder what's something that people might be surprised to know about mobile crisis services?
Yeah. So we truly are mobile, right? Like we can and will come to you. We work with a ton of schools in all of those school systems. We go out to the jails. We do quite a bit of telehealth. So we see all of the hospitals in our counties. And so we do those via telehealth, but we can come out. Like yesterday, I was at a private residence, right? So we can come to you.
Question that we get a lot is, do the police come?
Yeah, that's a great question. So if we go to a private residence, we typically do ask for law enforcement to meet us out there, right? Just for the safety of ourselves and that person. Now, if we go to a community setting, like a doctor's office or, a public building of some sort, typically, no, we don't start with law enforcement because it is a public place. But if transport is needed, that will either be done through AMR or sometimes we'll call law enforcement to help with that as well.
Mm-hmm. And what's AMR?
Sorry, ambulance services.
Oh, okay, right. So it is different than calling 911. Can you talk a little bit more about what that difference is?
Yeah, so I tell people 911 is going to be your go-to if someone is actively trying to hurt themselves or someone else, or if a weapon is involved, right? So if someone is having a mental health crisis and it meets any of that criteria, 911 is going to be your first call. Now, if it's someone that is either help seeking or just not really sure what to do, always call mobile crisis, and we can also help guide you. My triage staff is great. They do a very good job of also just providing resources, right? So sometimes they call and don't know how to help somebody or themselves. And so they can talk to them about the different resources in the community. And then they kind of guide that call to what should be the next step for that individual.
That's helpful to know. Yeah, it sounds like really calling you all is a one-stop shop for, like you said, that triage. So if we're not quite sure what to do, if we don't know if mobile crisis is appropriate, it sounds like if we give you all a call, you can point us in the right direction to connect us with resources or potentially help to keep somebody that we care about safe.
Yeah.
And I think that brings up for me wondering, can you help people understand a little bit more about what situations are appropriate for mobile crisis and then which situations might not be appropriate? I know you touched on that a little bit in what you said just a minute ago.
So what mobile crisis is assessing for is we are looking at least restrictive care for somebody, but we are assessing for inpatient hospitalization. So if you have someone that is expressing suicidal ideations or homicidal ideations or psychosis that puts them at a risk of hurting themselves or someone else, that's a time that you can call mobile crisis and we can come and do that assessment. Again, I would say if you know that there's a medical issue with the individual, or if you have, a weapon of some sort involved, that's going to be that 911 call.
That makes a lot of sense. And so that makes me wonder, can you call for somebody else?
You can. Yeah. We have people call all the time and say, hey, this is what's going on with my brother or my sister. And so we talk with them about what's going on with them specifically, and then start pointing them in the direction of the appropriate resources for them. So maybe it is outpatient services. Maybe it's our crisis stabilization unit. Maybe it's our empath unit. So we're able to give them kind of a direction as to where to go.
Awesome.
We talked a little bit about the empath unit last week or last month, actually.
Yes, we did. Oh, thanks. Yeah, Azita is very excited about those. So we'll
awesome.
probably talk about those a little bit more in a future podcast and definitely let people know more about that empath unit. Little teaser maybe to have you all come back for another one of our shows. So when I call and say you all decide, yes, this is an appropriate situation, we're going to send that mobile crisis team out to us. Or maybe if you all decide, yeah, we can handle this via telehealth. What are the response times for those two situations?
Yeah, so if we are coming out to you in the community, we are contracted to try and be there within an hour, right? Okay. So that is one reason that we do try and utilize telehealth, because if we go from Monroe County to Sevier County, I mean, that's like a 2-hour drive in itself, right? So we do try and do as much telehealth as possible, but we do meet people within an hour.
That's great. I know that sometimes time is really of the essence.
Yes.
And I know from experience with people that I've worked with, sometimes like a walk-in clinic, you might be waiting in that waiting room for hours.
Right. And sometimes we're able to direct people to our walk-in center. So we have an adult walk-in center. It's here based out of this office in Knox County, and it's open 24/7. And so a lot of times someone is safe enough to get themselves here, or someone can bring them here, and then we can assess them here.
So you kind of got both options there.
Yeah,
that's great.
McNabb does a lot of really great things, many options.
Yeah. I think so. I love McNabb. We are really growing into a big organization, which is great.
Yeah, and we're lucky to have that in Knoxville. Okay, so how can somebody call mobile crisis? How do they get in touch with you?
Great question. So our main number, and I'm sure we'll post this up somewhere, is 865-539-2409. And that is a 24/7 number. So it does not roll over to any sort of answering service, answering machine. Somebody will pick up that phone. When the calls are coming in like crazy, we've got triage staff, and then our clinicians answer the phone. So that's the best way to get in touch with us.
That's awesome. It's great that doesn't matter what time of day, if you've got questions, it really does sound like what I'm hearing from you is our door is open, our phone is ready, we've got people standing by. Anything you need, feel free to give us a call. And that's amazing to be able to have that service so that we talk about the different types of services and making sure that people get kind of the least invasive. So I know that's a clinical term, but we're trying to solve things with the least disruption to people's lives and really
Absolutely.
honor their autonomy. And it sounds like your mobile crisis services and the McNabb Center in general really is aligned with that value.
Yeah, I think I used the word least restrictive earlier, like least
Yeah.
restrictive care.
Yeah.
And so, yeah, that's the same thing, right? We are looking for what is going to disrupt that person's life in the least, right?
Got
Like
it.
not to make things unmanageable for them, but to really help them. And so a lot of times it is just maybe talking to somebody or starting outpatient services, which looks like med management or therapy services and things like that.
That's great. What I think when I'm starting to think now, I'm thinking, seeing this process in my head of I call up, I talk to somebody, and then you all say, yes, we are going to dispatch, we'll be there within the hour. What should someone expect when your team arrives at their home or maybe to one of the other locations in the community where you respond?
Yeah, so it's usually just one person that will go. Again, law enforcement will meet us out there. And then we'll just, if it's in a home, we'll go into the home and talk to the person and we'll do a crisis assessment, just to try and get, a feel for the situation and look at what kind of services does this individual need, right? Like, do they need to go to the hospital and get some more intensive inpatient services, or can we bring them to our crisis stabilization unit, which is a voluntary program, which is like a 3 to 5 day program. So it's a little less intense than the inpatient hospital. So yeah, we just kind of talk with them and see which kind of category they fall into almost, and what would be most helpful for them.
It brings up a question for me. I know that I've heard this question in many scenarios. What's the fee for service? How should they prepare
There
to pay
is
for
no
this visit?
fee. There is no fee. Yes. So, yeah, we, regardless of insurance, we will come out to you. And then in the hospitals, I will say we are kind of the gatekeepers for TennCare. So if anybody goes into an emergency room for a mental health crisis, if they are uninsured or have TennCare, Mobile Crisis does that assessment to look at inpatient hospitalization for them.
That's incredible. I know that can be a huge barrier for a lot of people. Whether or not they even know the answer to that question,
Oh,
they might really stay away from the service.
absolutely. Same thing with our crisis stabilization unit. Like we have grant beds and things like that. So that is important, I think, for people to know because, money is definitely a factor.
Yeah, absolutely. So no insurance necessary,
Mhm.
no financial burden. That's just incredible.
Yeah. More and more
And
reasons to just give the McNabb Center a call if you're
Absolutely.
not sure.
That's what I tell people. If you're unsure, just give us a call. Like we can at least start to help guide you in the direction, right? Like give you some more resources that you may not have on your own.
I know we're getting to the end of our time here of this episode.
So quick.
I could probably talk to you about this for another hour. Azita probably could too. But I think one thing just for people to take away from this. So if someone is watching this and they remember nothing else, what would you want them to know about how to use mobile crisis services?
My big thing is just call us if you are ever unsure, right? If you are unsure if this needs mobile crisis, just give us a call. Like I said, my triage staff is amazing. They are so good at talking to people, right? I mean, and it may not be that a mobile crisis clinician needs to come out. They might just need to talk to somebody to get them through this crisis, then transfer to like a warm line. So I always just tell people call. That's the best thing to do if you're ever unsure.
Sounds like an easy enough plan.
Yeah.
we will have the phone number that Vanessa mentioned for getting in touch with mobile crisis services, as well as some other information and resources in the podcast description on our website. Vanessa, thank you so much for being here and sharing this
Oh, yeah.
information.
Thanks for
Incredible. We're
having me.
so Absolutely. We're so, so grateful that you joined us today. And everyone, we will see you next month for the next episode of the Contact Listens Tools for Tough Moments podcasts.
Bye, everybody. Be well.
Bye.